seen the unsafe measures that hospitals have turned to in order to ventilate patients during a bottleneck. There's no reason that an inexpensive and life-sustaining technology is not readily available for those that need it, regardless of their location.
The mission that we at Project Prana are really following is to increase healthcare equity, and we do this in the space of intensive care medicine.
A full functioning ventilator is between $60,000 and $60,000, and iSAVE costs about $1,000, so we're able to serve double the patients at a fraction of the cost of a new ventilator.
iSAVE helps a clinician to safely ventilate 2 patients with only 1 ventilator. And the challenge is really to do it in a safe way and do it in a well-controlled way. One thing that is very, very important when designing such a device is making it as easy as possible for clinicians and nurses to use it. So for us, this meant our touchscreen monitoring interface is really inspired by the classical ventilator monitoring interface. So you see the same important parameters that a doctor would want to know about when ventilating a patient. You'll see the same parameters on our iSAVE device.
One challenge in trying to split ventilation between 2 patients is that each patient requires really specific monitoring capabilities, and doctors really need to be able to monitor each patient in a really busy hospital setting. So we developed the software interface that a doctor can pick up and take with them, so they're able to continue to monitor both patients and adjust pressure and volume accordingly to make sure that it's effective for both the patients they're trying to serve.
You can individually adjust what the ventilation pressure will be for each of those patients. You can individually adjust the amount of air that is going to each patient and thereby have full control over how you want to ventilate.
I think the ISHOW experience helped us sort of reframe how we were thinking about moving into new countries.
The value of conversation and feedback from the judges was practically limitless.
It's not enough to just have the technology and design it and develop and test and validate it, but it's really the challenge is to implement. And the moment it comes to implementation, it was incredibly valuable to have ISHOW on our side. What we are aiming to do is increasing healthcare equity. I truly believe that building technology is one of the few ways you can do the 3 golden things in healthcare, which are increasing access to care, increasing quality of care, while reducing the cost.
We really want to find ways to bring these low-cost yet effective solutions to places that need them most to reduce that health equity gap. And that's really at the center of our mission at Project Prana.